I'm Dr. Vidhya Sivakumaran, and I serve as the Vice President of Clinical Informatics and Terminology Data Engineering here at IMO Health. In plain terms, my work sits at the intersection of clinical medicine and data. So I focus on how we structure, organize, and enrich medical knowledge so that it's actually usable in real-world health tech applications. A part of what I do is making sure that when a clinician documents something in a health record or when an AI model tries to reason about a patient's condition, the underlying terminology and data are sound, consistent, and clinically meaningful. So a knowledge graph in simple terms, I guess you could think of a knowledge graph as a giant, intelligent map of medical concepts and the relationships between them. Rather than storing the fact that a patient has type 2 diabetes, a knowledge graph understands that type 2 diabetes is a type of metabolic disorder and that it's commonly associated with hypertension and obesity, and that it's treated with certain drug classes and that it maps to specific billing codes. So it's not just a list of terms, it's this living web of connections, and that context is what makes it so powerful for clinical application. So a knowledge graph improves explainability in AI models by, let's put it this way, if you think about one of the biggest challenges in AI in healthcare is this black box problem. So a model gives you a prediction, but you don't really have an idea why. What a knowledge graph does, it changes that because it gives AI a structured reasoning layer to work with. So because those relationships in that layer are already, in theory, validated, the AI is building on a trusted foundation from the start. So rather than leaving validation as an afterthought, if that makes sense. So when it flags a patient as high risk, you could actually follow the chain. So this patient has these conditions, which are linked to these risk factors, which suggests this outcome. That explainability isn't just nice to have in healthcare, it's essential. So clinicians need to trust the output, regulators need to audit it, and then patients deserve to understand decisions being made about their care. So the kinds of applications that benefit from a knowledge graph are pretty broad, actually, which speaks to how foundational this technology actually is. So on the clinical side, it could be seen as powering clinical decision support or possibly patient risk stratification and care gap identification. In life sciences, it's incredibly valuable for things like drug discovery, clinical trial matching, and pharmacovigilance. Understanding how drugs interact with conditions and patient populations are another angle of that. So if an organization wants to build AI or large language model applications in healthcare, a knowledge graph isn't necessarily a requirement, but if trust and scale matter, then it's probably what's going to set you apart within your application. Things that teams should look for in a knowledge graph. First things that I like to think about are clinical semantic precision or depth. Not all knowledge graphs are created equal. You want one that's built on real clinical expertise, not just mapped to existing code sets. Secondly, I think about breadth of coverage. Does it span diagnoses, procedures, labs, medications, social determinants of health, things like that? Healthcare is extremely complex, and gaps in coverage create gaps in that insight. Third, interoperability. It needs to speak the language of the systems you're working with, whether that's ICD, SNOMED, ARCS, NORM, LOINC, or any others. And fourth, and this is really underrated, staying current. Medical knowledge is evolving constantly. There are constantly people publishing new studies. There are new findings every day. So you need a knowledge graph that's actively maintained and updated. So not something that was built once and left to go stale. What makes IMO's knowledge graph different from standard code sets and ontologies is really the heart of what makes IMO Health distinctive. So standard code sets like ICD, CPT, SNOMED are super essential, but they were designed primarily for billing and reporting. They weren't built to capture the nuance of how clinicians actually think and speak and how they document. So what IMO Health has built actually goes several layers deeper, and we've got 30 years of expertise in this. Our knowledge graph doesn't just map codes, it captures clinical intent, specificity, and then the rich relationships between concepts. in a way that mirrors how physicians actually reason. And because of that, we've been in the space for decades working directly with our clinical experts. Our terminology has an accuracy and granularity that you simply cannot get anywhere else, and you can't get from assembling just from standard ontologies off the shelf. It's really the difference, if you think about it, between having a dictionary and a clinician who actually understands the language.